This week in my clinic, I saw something from a health insurance company that was just so dirty and disgusting that I have to tell you about it today. I've seen a lot of shenanigans from these health insurance companies in the past, and naturally, with my specialty, where I treat primarily neck and back pain, I order a lot of procedures and a lot of imaging that inevitably results in some denials. But I got a denial for a procedure that I ordered a couple weeks ago, and they sent me actually a physical copy of the denial in the mail. And I was flipping through it to see why specifically they said that this procedure was being denied. And at the end of it, after they listed their reasons, which are basically just algorithmically determined, and I usually follow my typical workup usually follows their algorithm. So when denials happen, a lot of times I don't really understand why it is, and usually they get overturned anyway. But this time I'm reading through all of those things, and at the bottom, there's the medical director's signature, which is a physician who basically stamps their name saying that they approve the denial, right? That they were the ones who are overseeing the denial. And usually it says their full name and their degree, MD or DO, and maybe some other acronyms afterwards. But this one just said TK, comma, MD, as in it was just the person's initials and not their actual name. And they were the ones who were denying the procedure. I thought this was disgusting because it was like cowardly, right? They were too ashamed to put their name out there and say that they were the ones denying this procedure. And of course, I understand with things that have happened in the past couple of years with health insurance companies, they may be fearful of what those repercussions are, but what does that say about what you're doing, right? And I know this seems gross maybe on this individual's um, what their decision was and their reasoning for doing this, but I think this actually paints a much bigger picture of what's going on in health insurance right now. And it actually tells us what more about how we need to act as physicians. And I'm going to talk to you about that today. I'm Dr. Nolan Fisher. This is Second Opinions. This is the show where physicians say what they actually think. Let's get into the episode. Let's talk about insurance. What are the three top complaints that people have about insurance? Well, there's cost, obviously, and then there's delays and denials. So let's start with cost. First off, insurance is getting way more expensive than it used to be. It's actually getting more expensive at a faster rate than inflation and even exceeding the rate that people's overall salaries and income is growing. Second, there's the delays that come along with a lot of care. So even if the insurance company isn't outright denying to pay for something, if they can delay care, a lot of times that keeps the money in their pocket for longer. And it also makes patients suffer more. Like, for example, if they have some pain that they need treated and they get delayed, they can be in pain for longer. If they have a cancer scare and they need some sort of imaging to see if it truly is cancer, there's going to come with this mental suffering of having to wait. And then, of course, there's denials where they just outright deny whatever was ordered. And this is maybe the most frustrating for the patients because they feel like they've spent all this money on their insurance premiums. And at the end of the day, the care that the doctor ordered is not actually going to get covered by that insurance they spent all the money on. Now, when you look at this, you would think, well, obviously what's happening, our insurance companies are charging more and more money, and then they're delaying or denying care so that way they don't have to spend more money. And as a result, they are making more money, right? They're keeping that difference. And yeah, this would be really bad, but the truth is actually much more complicated. You see, there's this paradox that exists as a result of the Affordable Care Act when they instituted something that was called the medical loss ratio. So what is the medical loss ratio? Well, that's that insurance companies are legally required to spend about 80 to 85% of the dollars they get from people's insurance premiums on actual medical care, meaning that they can only keep 15 to 20% to pay for their overall expenses, and any of that that's residual, then they get to keep as profit. So naturally, if you expand on that, you say, okay, if they get to keep 80, or if they have to spend 80 to 85%, they get to keep a percentage. Their only way to make more money is to have more people come into their system, right? So the overall dollar amount grows, or to spend more money on care, which then would increase the expense that is paid by the premiums, increase the overall dollar amount, which then their 15 to 20% would then be higher. So if that's the case, then why would you even deny at all, right? I mean, naturally, you would say, well, just approve everything, have people spend more money on care, and then that would justify the higher premiums that you have to charge the next year. Well, it's not that simple. You see, insurance companies, they are in it for the long haul, and they know that people will only tolerate a certain percentage increase in their premiums every year. And for them, that's about 5 to 8% or so, somewhere in that range. And people are okay, and companies are okay with paying that, at least for now. And then if they can keep the costs under control, they'll keep their customers, right? Additionally, if they delay care and they deny care, they know that even if they deny something, it may get overturned. And if they delay it, they might have to spend that money. But a lot of the premium dollars that they're actually getting up front. And they're able to take those dollars and then invest them and then get investment returns on those. So their, 50%, 15% chunk that they're getting, it's actually 15% plus investments, right? So that is why denials and delays happen, even though they're incentivized to even spend more money. But the insurance companies are not the only ones to blame here, because whenever it comes to delays and denials, it's like, why are these even, necessary in the first place? Well, the reason they're necessary is because the way that the payment model is set up for physicians and hospitals and different, practices. And that's our current model, is generally what we call fee for service. So fee for service means that if you do something, you get paid for it. And generally, if you do something that is more expensive, you generally get paid more for it. So clinic visits get paid a certain amount, but complex surgeries that are very expensive, they get paid substantially more. So the incentive problem here is for healthcare facilities, right? Hospitals, private practices, whatever. The physicians there get incentivized to provide more services. So they're not incentivized to control costs. Instead, they're incentivized to what we call overutilize. So the truth is that somebody has to be the bad guy. Somebody has to keep the checks and balances in a line here, so that way there's not excessive imaging or excessive, facility fees that happen whenever people are hospitalized, or unnecessary surgeries, because those do happen, and their results is because of the incentive structure. And in our current system, the insurance companies are the bad guys. However, I think that it has swung a little too far, and they've created this algorithmic care that's just denying unnecessary procedures. So now that we have kind of taken a look as to why insurance companies do what they do, right? And why the denials and delays are even necessary, I think we need to go back to the clinic and back to the medical director that signed the denial with just their initials, right? TKMD. I think we need to go back to the ethical duties of physicians, right? In a world where there are fewer and fewer insurances available, right? You have the same few companies that are running most of the major insurances. And most private practices are, getting bought up by hospitals. And most physicians are actually going into practice with large health systems rather than on their own. I mean, even just 15, 20 years ago, the majority of physicians would go practice in their own private practice. That's not the case anymore. 75% of graduating physicians are going to join a large hospital. What I think we have here is the responsibility of the physicians in these models need to push back, right? They need to say that we need to make sure that as physicians ordering these procedures and these images, that we are doing the right thing and we're not overutilizing, right? And second, we need to make sure that if you are working for one of these insurance companies, right, it's your ethical duty to make sure that you are not denying necessary care, right? And you're not part of the problem that's delaying the necessary care and making it difficult for people who are already spending all this money and want to have their suffering relieved. You're not making it more difficult for that to happen. So I think we need to take a look in the mirror as physicians. And then additionally, there needs to be incentive change that occurs. And that's a more large structural issue that needs to happen. But there are models for this. And so one of the models I want to talk about is my favorite business, and that's Costco. And Costco is just an awesome model in showing, especially when you contrast it to how health insurance works, because Costco is an example of a company that provides exceptional service to its customers. It decreases costs for customers, and it gets an efficient, large volume of people taken care of in a responsible way. And so let's compare and contrast the traditional health insurance model and the Costco model, and let's see what maybe health insurance in the future can learn from a company like Costco. So first, let's talk about the profits, right? Where do health insurance companies make their money, right? We already talked about this. It's the percentage of the total medical dollars spent. And that ratio is crucial. And of course, that's mandated in the Affordable Care Act. So that's something incentive that's created by our federal government. If we look at Costco, generally they get money from their annual membership fee. And then I'm sure they get a small percentage of profit, but I would guess that most of that actually goes towards running the overall business. So if you look at that, you could talk about that maybe the premiums are their membership fee, but the health insurance companies, they're trying to up those premiums. That's their only lever. Whereas Costco is keeping their membership fee relatively similar, and they're just trying to get more customers. Okay, now let's go to the incentives, right? So the incentives with the health insurance model is to let the costs rise, like we talked about, that 5 to 8% every single year, so that people will keep playing the game, they'll keep spending more money, and they can justify their higher premiums every year based on how much money they're spending on care. Costco's incentive is to keep prices as low as possible, right? They want to retain members and they want to get new members. And so as a result, they want to provide a very quality product at a low price and get more people. And that's not exactly the same with the insurance company, right? They just want to let the prices rise and rise and rise because they know they're going to get to keep more money based on that. Now, when we look at how the health insurance companies deal with their what they would consider suppliers, right? And Costco deals with their suppliers. This is where it really stands out, right? So, health insurance companies, they are going to negotiate against the providers and against the patients in the form of denials, right? So, their lever that they can pull is that when you try to spend money, they can deny it. So that way they get to keep their money for a little longer and they can invest it. Whereas the way Costco deals with their suppliers is they just negotiate ruthlessly to make sure that their customers are getting the best deal on the best possible product. And the way they can do this quality control is that not only do they get the best products by only carrying a certain number of things, if they don't feel like somebody is providing a good enough product, then they go ahead and they create a Kirkland brand version of it. So that way they can get a quality product at a low cost. Insurance companies, on the other hand, are basically negotiating off of contracted rates and how much they're willing to pay each individual hospital. When it just comes down to the money and that's all they care about, what they're getting are patients are, they're not getting the best quality care. They're just getting the cheapest or potentially the cheapest. And additionally, the hospitals have a lot of leverage going back too. So regardless, this is making it more expensive, right? It's very different. And so I think, when we compare these two, the key takeaway here is that if you can align the incentives to make sure that your customers are getting the best possible service at the lowest possible cost, not only are you ensuring that it's a good product, but you're also keeping the costs down. And the way that the health system and health insurance is built is that The health system wants to charge as much money as possible. They want to do as much as possible because that's how they make their money. Whereas the health insurance wants the overall cost to be more expensive, but they want to delay the care so they get to keep that money for a little longer and invest it. And they're okay increasing costs so long as it's at that rate that they know customers will continue to come back. And so that's it. That's a breakdown of what I saw in my clinic, how frustrating it was to see how dirty it was that they, had just their initials, and what that means for healthcare in general and our roles as physicians. And then I feel like a lot of times people feel like healthcare is just lost. And I actually really think there are ways that we can make healthcare much better in our country. And I think it all comes down to incentives like we see with Costco and the way they treat their customers. So that's it. I'm Dr. Nolan Fisher. This is Second Opinions. Thank you so much for watching. I'll see you next week.